So yesterday we talked about urinary system, anatomy and physiology. Okay, so this is the basic thing. Yesterday we discussed outline of anatomy and physiology. Today we are going to talk about an important topic related urinary tract. Okay, that is urinary tract infection. Urinary system. In the urinary system, today we are going to talk about urinary tract infection. This is the most common disease. Okay, so basically we have both kidneys. Okay, and from that we have urinary bladder. Okay, ureter and urethra. So these are the four important: kidney, ureter, urinary bladder, and urethra. These are the four important organs in the urinary system. If anyone is infected or troubled by anything, whole urinary system will affect. Okay, so initially the bacteria will enter through urethra to the urinary bladder. If it is not treated, gradually the infection will reach to the kidney. Gradually, the nephrons will affected, or pelvic or cortex medulla region will affected. Gradually, nephrons will affected. Then the single nephron to double, triple, and all the nephrons, mostly all the nephrons are affected. Then the kidney failure will occurs. So basically, the most of the causes are, most means more than 50 to 60%. UTI is the one of the reason of renal failure. Okay, kidney damage. Okay, UTI is one of the cause of renal failure or kidney damage. Okay, and we have kidney damage, acute renal infection. Okay, these are the things which related to the urinary tract infection. Okay, so that is the reason I started with UTI. So in that, most of the person are affected with the bacterial infection, that is E. coli. Other than E. coli, there are a number of bacteria like Candida albicans. Okay, Candida albicans. Okay, this is one of the bacteria, and pseudomonas. This is the third bacteria, and fourth bacteria is and entero E. coli. Okay, E. coli is one of the thing, and we have Streptococcus aureus. Okay, this is one of the powerful bacteria. Okay, and another one is Klebsiella. Okay, all these are bacteria which can affect the urinary tract, starting with urethra and ending with kidney. Okay, and sometimes it is due to the causes in that bacterial infection, and another one is due to the diabetic mellitus. DM, diabetes mellitus, also one of the reason of UTI. Okay, and what will happen in that? You can uh, what are the clinical features you can observe in UTI? So mostly, what are the symptoms are tiredness. Okay, one symptom is tiredness, and another one is sometimes increase in BP, hypertension also. Okay, and increase in the frequency of frequency, uh, micturition, micturition frequency increases. Okay, and in the fourth one, we can see that pain in the back pain, and fifth one is urine dark, or you can see that pus color urine, or there is a pus in urine, so it may look like milky color, dark milky color. Okay, these are the clinical symptoms. We can see that, and they have fever with chills, mostly in the night time. Fever with chills. If the bacteria is in normal, you have low grade fever. If the bacteria is high, and if they entered into the certain part, you can have high grade fever depending upon the bacteria. High grade fever. Okay, pain in uh, genital area, sometimes genital region or pelvic region. Okay, so these are the clinical features you can see in the patients: tiredness, raise in the BP, maturation, back pain, milky, dark milky color, urine or pus in urine, fever with chill, high grade fever, mostly in night, late night. Okay, pain in genital region. Okay, you can see. Okay, so these are the clinical features. So what type of examination you can do? You can do CUE, complete urine examination. Okay, complete urine examination. You can see number of things in that: pus cell, epithelial cells, RBC, and sugar, everything you can see in the CUE. In that you can see pus cells are high, and you can see epithelial tissues are also there due to the bacterial damage of bacteria to the internal part of urinary system. Okay, okay, you can see that due to that this infection you can develop cyst also, cystitis also in the, and you can also develop post, the infection will uh, reach to the prostate gland. We have the male and other parts of uh, female reproductive organs. Okay, reproductive organs mostly during pregnancy. Okay, pregnancy, in the pregnancy the female had developed UTI. Okay, and these are the things you have to remember. And sometimes what type of bacteria is there, you need to do urine culture. Okay, urine culture is culture and sensitivity. In that, what type of bacteria is there and which antibiotic works will give the pathologist. Okay, the pathologist will decide what type of bacteria is there and which antibiotic will work on that bacteria. Okay, so these are the things we have to remember in UTI. So pain will patient will complain about burning in micturition also, burning micturition, plain pain while going to urine. Okay. So these are the symptoms which help us to diagnose about UTI. Sometimes you need uh, ultrasonography also to see the structure of abdomen or urinary bladder, structure of the kidneys, urethra, okay, ureter, prostate gland, all you can see in the USG ultrasound. So if there is no structural changes, means that there is a bacteria is not enter into this part. All the body organs of urinary system are good in condition. So you need to treat the bacteria as much as early possible. Okay. So this is the initial things we have to do. Urine examination, urine culture, and ultrasonography. Other than that, there are number of tests also there, but according to the condition, here only about UTI we are talking. So according to UTI, we will plan. Okay, so what is the treatment part? In that, according to the bacteria, okay. So mostly UTI takes long-term treatment. It may take more. If it is acute condition, you need to take more than 2 months. I think. Okay, sometimes if it is chronic, more than 4 months. Treatment required. Okay. So here we'll start with the kidney remedies, S6, L1B, okay, and we have C6, Ven1, G, okay, and to improve the urine flow, we'll give C17, okay, rapid dose, and we have as a antibiotic C1, Ver1, and D5. This you can give according to the condition. Initially, we start with D5, then D4, then D6. Okay. Next, we have another wonderful remedy, that is C17, A2, Ven1, GE or B. If there is burning sensation, you add B. If there's no burning sensation, you can give GE. So this is very good remedy for all types of urinary tract infection. Will work wonderful. Okay. So you can add C5 also if necessary. If not, only C17. Okay. Okay. So only C17. Okay. So this is the urinary tract infection treatment. You can add to the patient. You will get definite results. And other than that, if necessary, you can add S6, C6, YE also. Okay. In D5. And if necessary, you can have to apply the electricities also. Okay. Electricities also. That is compression. Cold compression is required in the mostly the urinary tract infection. Okay. Cold compression. You can have GE or B. Along with you can add Ver2 also. Okay. So this will give more benefit to the patient and it will work rapidly to the patient. Okay. So these are the remedies you can use in the urinary tract infection. So what is urinary tract infection? Urinary tract infection is an infection which enter through the urethra to the all, maybe some extent of urinary tract, all parts of the urinary tract. It may leads to number of chronic diseases. It may be leads to uh, failure of kidneys. Okay, if it is not treated. Okay, so there are number of bacterial infection which will cause harm, like E. coli, Candida, Pseudomonas, Streptococcus, Klebsiella. All these are very harmful bacteria which will damage our kidneys also. So, and another is, what are the other causes also? We have diabetic also. It is one of the cause which may leads to UTI, and due to the high level sugars in the body. And you have clinical features like tiredness, raised in temperature, in the BP levels, hypertension, micturition, back pain, pus in urine or milky color urine. Okay, fever with chills in the night region, right? Okay, and pain in genital region or pelvic region, burning in micturition, pain while going urine. These are the symptoms. Okay, and what type of examination you can do? Complete urine examination is required, and sometimes you need ultrasonography, and sometimes you need urine culture and sensitivity. Okay, to understand the what type of bacteria is there and what type of treatment you have to do give. This will done by pathologist with our requester. This is the treatment plan. Okay, and this is the application for externally for UTI. Okay, so this is all about in today's class. If any doubts, kindly ask. And second thing is that in the urinary system, we have mostly urine acute renal failure or chronic renal failure. These are the one thing. And second one is we have cystitis, cystitis, and third one is UTI, and fourth one is most common diseases as renal calculi. Okay, so these are the four important diseases we will discuss in this medicine. Okay, if any doubts, kindly ask.